I'm Zoe Hilton. I'm Research Chair in Forensic Mental Health at Waypoint Center for Mental Health Care. Waypoint is a mental health hospital providing services both inpatient and outpatient in our region, and also provide provincial level service for people involved with the justice system in Ontario. So the ODARA is a brief risk assessment tool that's used to identify the risk that an individual who's assaulted their intimate partner will assault a partner again in the future. The ODARA was created as part of a partnership between researchers at this hospital and the Ontario Provincial Police, and it was to respond to a number of high-profile femicide cases that occurred in the province, and an interministerial working group recommending that people work on having risk assessment instruments both for policing and for later in the criminal justice system and other systems providing services for intimate partner violence as well. At the time, there were no easy-to-use validated risk assessment tools for the risk of intimate partner violence. So the ODARA was the first validated tool in Ontario, and it's now one of the most widely used intimate partner violence risk assessment tools in Canada. Well, intimate partner violence causes serious harms, especially for women who are more likely to be physically injured. So it's important for their physical health and safety, as well as for their mental health and well-being, that victim safety planning and risk management, especially of higher risk cases, can be put into place, whether it's by mental health services, other health services, policing services, elsewhere in the criminal justice system, and of course community victim support services. Without a tool like the ODARA, it's difficult to identify which cases are at most risk and need most urgent support and most intensive intervention and the best of the services that we have available. If we had unlimited resources to support people who'd been abused, then we wouldn't need a tool like the ODARA, but because services are limited, then we need a tool that can help us identify the riskiest cases. The ODARA has been studied not just here at Waypoint, but by other researchers in Canada and outside of Canada as well. And having a validated tool like the ODARA is important to people who are looking to see what tools they're going to use. And also our online program that Waypoint supports, ODARA 101, means that assessors around the world can learn how to use the ODARA anytime, anywhere, and at no cost. So that's been a big part of assessors and organizations and governments being able to take up use of the ODARA. So the ODARA 101 is accessible to any organization that is responding to intimate partner violence, either supporting individuals who've been abused or providing services for people who have perpetrated intimate partner violence. And it's just a matter of registering with us, and then they and their staff can access ODARA 101. So the research to create the ODARA took place over a course of about 5 years, and it was really an example of Waypoint's successful partnerships with community agencies and other ministries at the time. Many of us came together to identify how the information could be gathered and tested in a valid way. When we first published the ODARA, we published it along with the first validation, so the initial test and then a validation and a new sample, and we immediately started doing new validation tests right away. And then there have now been about 25 different evaluations validating the ODARA in different populations, different samples, different outcomes, and so on. You did touch on this as to why Waypoint would want to be involved with a project like this. And because intimate partner violence, especially among women, has such adverse effects on women's physical safety and injuries, as well as their mental health and well-being, the ODARA is one way that Waypoint can support women's mental health. We have certainly collaborated with women's services, shelters in our areas, and in our ongoing research. So we have a growing body of research at Waypoint now into intimate partner violence, and we're actively forging new relationships and collaborations with shelters and women's services all the time. I've been really proud. It's been really good to see how useful the ODARA has been, both in our community here around Waypoint and globally among all users of the ODARA and all those who are trying to work towards better safety and protection for women and others who have been victims of intimate partner violence. And I'm really excited to see the work that is going on here at Waypoint, continuing to support and develop the ODARA and other areas of intimate partner violence research and service.